Good morning, I'm Dr. Heba Ghannoum and our topic today is non-suppurative otitis media. Chronic otitis media is divided into two types, chronic non-suppurative and chronic suppurative otitis media. Non-suppurative يعني there is no pus inside the middle ear cavity, يعني we have an intact tympanic membrane as long as we don't have pus inside the middle ear cavity. What are the two types of non-suppurative otitis media? Secretory otitis media or the otitis media with effusion and adhesive otitis media. يعني ايه secretory otitis media؟ يعني fluid inside the middle ear cavity, but this fluid is not pus, it's sterile fluid inside the middle ear cavity. Adhesive otitis media, from its name, adhesions inside the middle ear cavity. The second type, chronic suppurative otitis media, it's either safe or unsafe, or tubotympanic and atticoantral. And chronic suppurative otitis media is not the scope of our lecture today. We will be discussing in detail the chronic non-suppurative otitis media. Chronic secretory otitis media or otitis media with effusion, as we mentioned earlier, is the presence of non-purulent fluid inside the middle ear cavity. What is the etiology of otitis media with effusion? It can be caused by eustachian tube obstruction at the level of the eustachian tube orifice, something causing obstruction as adenoids or nasopharyngeal tumors as nasopharyngeal carcinoma, or at the level of the whole tube, eustachian tube edema as in cases of infection or allergy. What are the other causes? In case of unresolved acute otitis media due to inadequate treatment, inadequate antibiotic treatment, and the last cause is eustachian tube muscle dysfunction that can be seen in children born with cleft palate. Otitis media with effusion is the commonest cause of bilateral conductive hearing loss in children. Patients will present with hearing loss and tinnitus and sensation of fluid in the ear or bubbling sound during nose blowing. What are the signs of secretory otitis media? By otoscopy, we'll find a dull tympanic membrane, and it might show an amber yellow or a grayish tinge. Also, we can see sometimes the air bubbles or the hairline from the fluid level, as seen in the above photos. What about the tuning fork tests? The tuning fork tests will show conductive hearing loss. يعني إيه؟ يعني we'll find bone conduction is better than air conduction. What are the investigations needed for a case of otitis media with effusion? First, for hearing assessment, we need audiometry and tympanometry. Audiometry will show conductive hearing loss, while tympanometry will show type B curved tympanogram. X-ray nasopharynx lateral view to exclude adenoids because they are the commonest cause of the eustachian tube obstruction, especially in children. Treatment of secretory otitis media, we have two options, either medical treatment or surgical, the conservative or medical treatment. Number one, treating the predisposing factors, such as in cases of enlarged adenoids causing obstruction of the eustachian tube, enamel adenoidectomy. Antibiotics to prevent recurrent infections, mucolytics to dissolve the mucus inside the middle ear cavity, corticosteroids systemically, nasal decongestants to help opening of the eustachian tube, and finally inflation of eustachian tube either by Valsalva maneuver, which is forced expiration while both your mouth and nose are closed, or by chewing gums. The patient is usually given several trials with the conservative method together with follow-up, hoping for the resolution of secretory otitis media. In case conservative method failed, then this patient is referred for surgery, which is myringotomy in this case, an incision in the tympanic membrane, followed by aspiration of the glue ear, the fluid inside the middle ear cavity, and insertion of a ventilation tube. Why do we insert a ventilation tube? We insert a ventilation tube in order to have a replacement for the Eustachian tube, which is not functioning. So it acts as a replacement for the non-functioning or the poor function of the Eustachian tube. What are the types of ventilation tubes that are used? There are two types actually. The Gromit's tube, which is the temporary ventilation tube that is usually extruded within 6 months. And the second type is the T-tube, which is the ventilation tube that stays for a longer duration until removed. We now come to the second type of chronic non-suppurative otitis media, which is adhesive otitis media. من اسمها كده, what is adhesive otitis media? It's the presence of fibrous adhesions inside the middle ear cavity, causing limitation of movement to the tympanic membrane and the ossicles. And these fibrous adhesions are formed by organization of the inflammatory exudate present inside the middle ear cavity. Etiology, what's the etiology of chronic adhesive otitis media? Either long-standing Eustachian tube obstruction or following secretory otitis media or healed chronic suppurative otitis media. Clinical picture and investigations of adhesive otitis media. This patient will present with hearing loss and tinnitus. Signs by otoscopy, you will find the signs of a retracted drum, and we mentioned the signs of retracted drum earlier. كانوا shortened handle of malleus, prominent lateral process, exaggerated anterior and posterior malleolar folds, distorted cone of light, and finally the limited mobility of the tympanic membrane by sigillization. Also by otoscopy you can find another finding اللي هي sometimes you can see the white patches of what we call the tympanosclerotic patches. By tuning fork testing you will find conductive hearing loss. يعني إيه؟ يعني you will find the bone conduction better than air conduction. What about the investigations for a case of adhesive otitis media? By pure tone audiogram you will find conductive hearing loss. Sometimes you can find mixed hearing loss. Tympanometry بقى you can find actually in textbooks some state that it's type AS, and other textbooks you can find they stated that it's type C tympanogram. But by clinical experience you can find with adhesive otitis media you can find type AS, type C, type B tympanogram, and even sometimes you can find type A curve tympanogram, depending on the extent of the adhesions inside the middle ear cavity. Finally, we come to treatment of adhesive otitis media. دايما الوقاية خير من العلاج. فبروفيلاكتيك ازاي؟ by proper treatment of acute otitis media and cases of secretory otitis media. What about curative? Curative, we have two options. The first option is tympanoplasty and cutting of the adhesions, but the problem with surgery in cases of adhesive otitis media هي recurrence. Recurrence is quite common. The second option هو hearing aid fitting.